Thank you very much, Tracy. That was great. Before we get started, I really just want to take a second and say thank you to Tracy and the whole APHSA team. They have spent so many months preparing for this event, this summit, and it's already going very well. Also want to make sure to say thank you to the rest of the governing board, who we've been together this morning for about 6 hours. And the reason I say thanks for that, normally when you leave a 6-hour meeting, you leave a little bit fatigued. I would tell you, I speak for myself. I left incredibly energized because of the people in that room. The people on the governing board and on the leadership council are people who challenge one another. We wrestle with very difficult conversations, and all with the intent of building systems that work better for children and families across the nation. And they keep us all humble, and we sharpen one another. So it's really wonderful. So thank you all very much for the day today. But I also want to make sure that these thoughts that I'm about to share with you, I would love for each of you to think about sharpening me in these thoughts. So if you have something to add, or it's just some idea or a concern, please grab me somewhere over the next few days and help to sharpen me. I appreciate that. So I wanted to start with a single statistic. In the state of Oklahoma last year, we received 82,000 calls to the Child Abuse and Neglect Hotline. It's important to note that 90% of those calls were neglect, not abuse, and 70% of those were related to poverty. For us in the Oklahoma Department of Human Services in 2019, October of 2019, we launched a process called Finding Our True North. And as a part of that True North, we created 3 to 5 guiding philosophies for each of our divisions. We also created 9 agency-wide, what we call executive leadership True Norths. And why is that important? There are 2 of those agency-wide True North strategies and philosophies that are intending to impact poverty. So I'm gonna briefly touch on those and then give you an illustration that helps us all think about poverty in the state of Oklahoma and may be useful for you. Executive leadership True North number 8 is moving upstream, meeting our families before they become in crisis. The intent is to never know those families in the child welfare system because we already knew them and met their needs in the Adult and Family Services Division, the social safety net. The second True North that's relevant to this conversation is Executive Leadership True North number 2, which is removing systemic barriers that keep our customers from accessing resources. So these are 2 really important True North philosophies that we built 2.5 years ago and that really informed our work during the pandemic and actually will inform the work of the entire agency and our human services system for the next decade or more. So now I promised an illustration. So I'm going to try this one out and see how it works in light of both of those True North philosophies that I just laid out. So I'm going to take you back to your childhood, and there's a game that you may remember playing called Chutes and Ladders. So if you'll remember the game Chutes and Ladders, let's use the game Chutes and Ladders as a context for poverty and see if we can work through it together. I don't use the game to trivialize the issue of poverty, but it is a pretty strong illustration of the opportunities that exist or the lack thereof for those families who we serve in the human services systems. So if you think about the game Chutes and Ladders, there are some boxes on the game board, and your goal is to get to the top of the game board and meet your own level, or own definition of success. So we're a hope-centered organization. I love the word hope that was used earlier. As a hope-centered organization, we use terminology like goals. These are goals that we set for ourselves. And as we spin the dial on the game Chutes and Ladders, we're able to move up the game board from level to level. In some cases, there are ladders that take us multiple levels up the game board. And in our lives and in the context of poverty and the economic system, those ladders can be represented by an improved job opportunity, a promotion at work, a raise, a marriage. There are lots of things that can help to progress us up multiple levels. And in other cases, there are chutes that we run into, and those chutes at times can take us all the way to the bottom of the game board. And in our lives, those chutes can be represented by a catastrophic health emergency, a death in the family, or a worldwide pandemic. There are lots of things that can take us all the way down to the bottom of the game board. And the way I see it is, and this is arguable, but the safety net sits below the game board and catches our bodies from physically dying and puts us back onto the bottom of the game board. It's essentially a one-size-fits-all approach. When I think the opportunity for the safety net is for us is to build a safety net that is much more nimble and custom and follows us where we go, catching us as close as possible from where we fell and putting us right back onto the game board as close as it can. Why is that important? I see a few reasons. The first is it's dignifying. I spent my entire life getting to space 43, and just because of an event that I couldn't control, I could fall all the way down to the bottom and have to fall back to space 3. Second is it's a multiple generation approach, a 2-generation approach. We all here know the impact of a child, my child, starting on the shoulders of somebody who was on space 43 versus space 3. And then, of course, the third is it's more tax efficient. It is efficient for our taxpayers and government to have to replace us and only give us this level of intervention instead of going all the way from the bottom and trying to help us elevate all the way back to the beginning. So obviously multiple reasons that exists. So the next question, of course, comes, how do we create a custom, more nimble safety net that follows people where they go? And we see two components in Oklahoma. One are the systems and resources that we offer. Those are the training programs that we offer through Career Tech. Those are the education system. It's the SNAP benefits. It's the actual resources that we provide that are intending to help families in their time of need. It's cash assistance in the right ways. That's where we think about things like benefits cliffs and those sorts of issues. The other component, however, is the one that we are spending the most time on, the Oklahoma Department of Human Services, and that's the distribution model. It's how we get the programs and resources to the people that need them when and where they need them. That's the big work that we're doing today. So there are 3 different components that we see to building the distribution model, this new way of reaching the people that we serve where they are. The first are the people, and so we've invested deeply in embedded workers. We actually, prior to the pandemic, had a laptop order of 6,000 laptops because this was a strategy that we deployed in that Executive Leadership True North number 2, which is removing systemic barriers. Our intent was to take our workforce that's so passionate and embed them in community partners all over the state of Oklahoma. In fact, even in the midst of a worldwide pandemic, we have deployed more than 400 safety net type resources or employees, team members into the community. So today you can find OKDHS workers in homeless shelters and schools and law enforcement offices, really intending to meet the person that we're serving where they are. The second component is the places. So I talked about people. The second is places. Of course, the embedded worker strategy embeds them in specific places. But there have been some really intentional ideas built around the places in which we meet those that we serve. One is we are on what we call the second round of real estate modernization. We've closed about 41 what I call dinosaur buildings. These are the old, for those of you in government, you know what dinosaur buildings are. These are the old government buildings that are really oppressive and quiet and dark. We've closed 41 of those already, with the intent to close more. However, the intent isn't to exit communities, it's to go deeper. So of course, the embedded worker strategy is one component of that, but now we are building strategically located and intentionally designed smaller buildings within our communities. So these are buildings like, there are actually 3 different types. We refer to them as a retail branch, so it's sort of like a bank branch. It's small. It's a 3,000 or 4,000 square foot building where you can meet in person and engage with a OKDHS safety net worker to get your benefits, the benefits that you need. That's if you cannot engage with technology or contact centers, which we're actually much better at than we used to be. The second is an administrative hub. It's all about working at the largest agency in the state where you can do onboarding and training and collaborations and those sorts of things. And then the third is a intentionally designed child welfare space, where our team has the resources that they need in a trauma-informed space to make middle-of-the-night placements, to do family team meetings, and to do visitations and those sorts of things. So that's the real estate modernization phase that we're working on now. But one thing I also wanted to mention is the other component to the places is this new strategy that we've built called Hope Centers, Community Hope Centers. We're on evolution number 2. We started with youth development hope centers, where we wrap resources around providers like Boys and Girls Clubs and urban leagues and YMCAs to serve in much deeper ways in their communities. The next round, evolution 2, is called a workforce hope center. And the idea is that a single place that you can walk into essentially experiencing homelessness and receive everything you need from a workforce perspective. That's work readiness programs, that's GED, ESL programs, it's meet a career coach and work along a career pathway, all in one place with embedded career tech. But one of the reasons we know that people don't engage for the long term in workforce programs is because life happens. And so in these buildings, every single resource exists to overcome barriers for you. So that's on-site childcare. That's that you can meet with 5 government agencies on site. That's unemployment insurance. It's, of course, the Department of Human Services for eligibility sorts of things, safety net. It's Central Oklahoma Workforce Board for workforce training. It's housing vouchers, those sorts of things. But also on site is a mental health provider, a physical health provider for a safety net clinic so that you can get immunizations and well child checks, those sorts of things. Food pantry, professional clothing closet. We're on a bus route, all of those things. One thing that is critically important in these is it's consistent case management, so you always meet with the same person all the time, regardless of the resources that you're using. And it's connected by technology, so we can watch you along your pathway to success. So that's our Workforce Hope Center strategy, a part of our distribution model. The third component to this new distribution model is one we could talk about in our own time, but it is technology. It's the way that we align our digital infrastructure with our physical infrastructure. So there are some incredible things happening in human services, aligning to Tracy's point with other systems that are intending to serve the same people. It is a time in which leaders like those of you in this room who have weathered a pandemic are now well positioned to transform your systems to truly meet people where they are with the resources that they need in the amounts in which they need them. So I am so honored to be here. Thank you for your time. And I'm excited about the next 3 or 4 days thinking with you about how to sharpen each one of our own tools and skills to build a set of safety net resources that meet people where they are. Thank you very much.